I'm Dr. Anthony Cave, a Stanford and Harvard trained anesthesiologist and integrative medicine specialist. I prefer to know a patient's birth sex because it affects my ability to safely care for them, like what size breathing tube to use and what types of medications and what doses are right for them. It's not political, it's about giving my patients the best care that they deserve. And of course, it depends on the type of surgery and other factors around the operating room. So when I once had a 12-year-old patient come in for a tonsillectomy and I couldn't tell whether they were a boy or a girl by speaking with them, I had a problem. This 12-year-old was 5 foot 5 inches and had an impressive amount of facial hair, but they also had very feminine facial features. Worse yet, this patient was already on 2 antidepressants despite only being 12 years old. Fortunately, I was able to speak with the patient's mother and father, who explained the unfortunate story of their daughter unknowingly being exposed to the mother and father's testosterone medication from a young age, leading to virilizing sexual characteristics or masculinizing effects, which pushed her into precocious puberty or early onset puberty. And that precocious puberty had taken a serious physical and mental health toll on her. And no one had ever explained to the parents the risk of their medications silently affecting their daughter over time. So in this video, you're going to learn the risks of these powerful healing treatments, not only to yourself, but also those around you. And importantly, how to prevent or minimize those risks based on the form of hormone replacement therapy that you choose. Before we go into the risks of testosterone, remember that proper balance of testosterone is vital for our physical and mental health in both women and men. In fact, balanced testosterone supports many parts of your wellness, including your mood, a healthy stress response, a normalized fear response, sexual well-being, and even possibly bone and heart health and an overall sense of well-being. Do you know anyone who's benefited from testosterone replacement therapy? Let me know in the comments below so that others can learn from their experience. Of course, testosterone replacement therapy, or TRT, is not a miracle. Like any medication or hormone or chemical, when unbalanced, can lead to all sorts of side effects and complications. In fact, it can worsen many of these exact same health markers that we're trying to optimize and improve when balancing testosterone and other hormones. I have a whole video on TRT in women that's linked below that you can watch so you can better appreciate the importance of balancing testosterone, especially in women. What patients and some doctors may not fully appreciate, however, is the risks that other people have when you're using these hormones. If unbalanced, sex steroids, including testosterone and estrogen, can affect our behaviors towards others. For example, testosterone can affect mania and aggression. It can also affect depressed mood. DHEAS in particular can increase anxiety and possibly depression in women. And of course, there's estrogen's role in anxiety and depression as well, both in premenopausal and postmenopausal women. There's even this offensive paper out there that describes the deplorable behavior of women based on hormone imbalance. I know it's a super rude and bizarre title, but the key is that hormone balancing is important. And it's not just the mood effects of these sex steroids, but also the direct chemical transfer to people around us. Because sex steroids are lipid soluble, meaning that they easily mix with fatty substances, they can easily penetrate your skin. And they can also hang around your clothes for a long time and even survive the washing machine, where they can also transfer to other people's clothes and then go through their skin when they put those clothes on. This raises the risk of transference, or the transfer of that medication to someone other than the intended patient. Look at the example of this 5-year-old boy who had transference of testosterone from his dad onto himself and began racing through puberty with big muscles, big testicles, and an enlarged penis. While many of these symptoms tend to regress after the external source of testosterone is eliminated, the increase in penis size in boys or clitoral size in girls can persist. And this is why the FDA has a boxed warning on these medications to indicate the risk of transference to others, especially children. And this is what happened to my patient, leading to her early onset of puberty and virilizing sexual characteristics, and I suspect the crisis in her mental health as well. So let's discuss the different forms of hormone replacement therapy so that you can better understand the risks and benefits associated with each one. And if you're learning something new, please share with your loved ones and hit the like button and subscribe to keep up with all of my medical advocacy. Some of the most common testosterone replacement therapies are topical, either in the nose or somewhere on the skin, like with a gel, a cream, or a patch. These are short-acting forms of testosterone, meaning that they dump their payload of medication in a relatively short period of time and therefore need to be redosed sometimes multiple times a day or at least every day. They transfer through the skin into the bloodstream, and there can be some fluctuation in that uptake, which can lead theoretically to fluctuations in the blood levels of the testosterone. These are typically very safe with direct doctor supervision, but they can cause headaches and local skin irritation in addition to the other side effects of testosterone replacement therapy. And unfortunately, that same topical application can transfer to people who you touch or hold or share clothes with, including children. They can even transfer to other clothes in the washing machine. While it's unlikely that transference through washing clothes in the washing machine is going to cause a serious problem, it really depends on what the dose is, and one can't know for certain. Next are testosterone shots, which are an intermediate form of testosterone replacement therapy. Depending on the specific formulation, some shots are given once a week or once every other week, or sometimes even less frequently, and they avoid the risk of transference that topical applications have, because once the injection goes in, it's not going to spread to other people directly. However, anytime you inject a drug into your body, there's a high possibility that there's going to be a rapid uptake temporarily, which might lead to abnormally high levels or supratherapeutic levels of the drug. And testosterone is no exception to that rule, where blood levels rise much higher with shots than they do with creams or other topical applications. This can lead to elevated blood pressure in addition to scar formation and bleeding and bruising at the injection site. Personally, I wonder what the long-term effects are of these temporary blips or bursts in testosterone dosing on certain critical organs like the heart and the prostate when testosterone is used for years and years and years on end. It's not super clear what the long-term effects are with these supraphysiological bumps. Lastly, there are subcutaneous pellets. These little guys are inserted under the skin in your doctor's office. What we do is numb the skin, make a small little incision, and then insert that pellet there where it can slowly dissolve over time to release the payload of testosterone over months, maybe 3 to 6 months, depending on the dose and the individual. This slow release pellet is usually inserted around the buttocks and avoids the risk of transference to others because it's not topically on your skin anymore. It also eliminates the need for frequent injections or redosing and the risks of supraphysiological bumps in the testosterone level because it tends to be much more of a gentle, slow release over time. And because it releases so slowly over those 3 to 6 months, you typically don't need to be redosing anytime soon, and you don't have any risk of missed doses. There is a risk of scar tissue forming around the site and a risk of that pellet popping out if there's too much pressure placed in the wrong direction. It also might take a little bit longer to reach the new steady state of testosterone as that pellet begins to dissolve and release the drug. So what about oral pills? For those of you guys wondering, in the United States, oral testosterone is very rare, largely for safety and efficacy reasons, so we won't talk about them in this video. If you or a loved one will benefit from testosterone replacement therapy, you should work with a doctor who's facile in all these different applications so they can adequately describe the risks, benefits, and alternatives to each different formulation. If you live with kids or work around kids, you need to be extra careful of that risk of transference, like what we saw in my patient in the operating room. On top of the different administration routes of testosterone, there's also many different synthetic types of testosterone that are different from the bioidentical testosterone. Which version is better is very controversial, but many providers, at least here in San Francisco, tend to recommend the bioidentical version because it's identical to what your body ordinarily has. That doesn't mean it's necessarily better or safer, and it's a discussion that you need to have with your doctor about what form and administration route is right for you. You can always learn about my clinic's approach towards balancing hormones for physical health and mental health here in San Francisco by visiting our website at www.claris-health.com. And please remember to hit that like button and subscribe if you learned something new, and don't forget that you have more power over your health than you've probably ever been told.